and welcome to the Center for Optimizing Rural Health September webinar, Top Recruiting and Retention Strategies for Rural and Underserved Communities. Thank you for joining us today. I am Cassidy Avila, and I will be the moderator for this webinar. I believe all participants are set to mute at this time, but if you have a question during the presentation, you may type it into the chat box and we will address all questions at the end of the presentation. If you would like to ask a question anonymously, you may send it to me by selecting my name from the drop-down box in the chat menu, and I will ask it on your behalf during the Q&A. It is now my privilege to introduce our speaker, Michelle Varjo from 3RNet. Michelle is the Director of Education Outreach for 3RNet. In this role, Michelle coordinates education-related activities for 3RNet members and rural facilities across the country, including trainings using 3RNet's educational tools, such as the Recruiting for Retention Manual, a rural-focused plan and guidebook focused on finding and keeping providers in rural areas. Prior to joining 3RNet, Michelle was a Human Resources Director for a federally qualified health center in Jefferson City, Missouri, where she helped them grow from 5 employees in one location to 110 employees in 4 locations serving over 13 counties. The services provided included family medicine, pediatrics, obstetrics, pain management, behavioral health, dental, and nutrition counseling. In this role, she created and implemented strategies and best practices to overcome the unique barriers to recruiting and retaining providers in the rural healthcare arena. Michelle has over 20 years of experience in healthcare-related human resources, both at the local and national level. She has an MBA from Williams Woods University and a bachelor's degree in business administration from Columbia College. She holds a senior professional human resources certification since 2003. Michelle, welcome, and thank you so much for being here today. I will hand it over to you.
Great, thanks, Cassidy. Can everybody see my screen okay? Seeing the slides?
Yeah, it looks great.
Is that good? Okay, great. So we've got about an hour to spend together today, and what I'm going to do is just hit on some top recruiting and retention strategies for rural and underserved areas. That's kind of what 3RNet does. We're always known as the rural kind of people. So we'll get right into it. Just a little bit about who is 3RNet. We are a nonprofit membership association, so all 50 states are our member. We also have the VA, Indian Health Services, and a couple of other federal agencies that are our member. Each member is unique. We've been around for a little over 25 years, and we do get some funding from FORHP. My particular area of expertise is in the education outreach, with doing what we're doing right now, which is webinars. And what I'm going to be talking about today is based on our 3RNet manual, which is a recruitment for retention 15-step manual, and I'll get into that more here in just a minute. So I always like to start off with this cartoon. Is this how a lot of you feel like your recruiting is going? You can just raise your hand and say, yep, that's me, right? You feel like you just get in this endless cycle of find, hire, train, and replace. Well, we're going to talk today about how you can maybe break that cycle a little bit. So before I get into all this, I do want to talk a little bit about what our new normal is. Right? So COVID-19 has disrupted your workflow. What we were doing to recruit and retain even 6 months ago is different than what it is now. And I just want to take a moment to recognize that. And so with that, throughout this presentation today, I will touch on that point a little bit and give you some new strategies or just recognize some of your struggles that you may be having based on COVID. So when I talk about recruitment, we generally don't say recruitment and retention here at 3RNet. We say recruitment for retention because we believe that retention starts all the way back in the recruitment process. But there are some core beliefs that we have. So what the 4 are that process and teamwork are key, meaning that there is a process to it and that you have to have good teamwork for it to be successful. It's both a science and an art. If it was just a science, I could sell you the manual for $19.99 and we could all be done and have the rest of our lunch hour off, right? But it's not that simple. And it's a little bit more than an art form. If it was just an art, there wouldn't be best practices for us to follow, right? So most people in the recruiting world know that it's a balancing act between being a science and an art. The third point we want to talk about a little bit, and I get into this some more, is competition is fierce, right? And therefore, you got to have a lot of your communication be candidate driven. And we'll talk about that more in depth later on. And then the fourth belief we have is that there are people and tools that exist to help you recruit more effectively. And one thing I can say about in our new normal is that we are finding these 4 core beliefs still exist today, even with, within our new normal. So what I'm going to do real quick is go through the recruitment for retention process. There are 4 parts to this process. There's the planning and prep, there's sourcing, screening, and then follow-up, follow-through, retention. Okay, so that's our 4 pieces. And then we have it, this is based on our manual, we have 15 steps within all 4 of these pieces. And today, in the interest of time, I'm going to just pick out a couple of what I feel are probably out of these 15 steps, things that are more key strategies that you can use to make your life hopefully a little bit easier. So the first section that we'll go over, of course, is part 1, planning and preparation. And out of this one, I'm going to talk about the 6 steps real quick, but I'll do a little bit more on step 3 and step 4. But when we talk about planning and prep, a lot of times I'm going to give you a scenario so you can think about this in your mind as we're going through this today. Let's say you're sitting at your desk on a Tuesday morning and your top producing provider walks in the door and says, I'm leaving. I'm moving out of town and I'm going to go. So the first thing most people think of, and let me just add this caveat for all my HR people out there. Yes, we tried to get them to stay. Yes, we've gone through all the stuff that we want to go through, right? So you know that your provider's leaving. Usually the very first thing people do is what? They want to post the job, right? They want to go right to sourcing. And we're saying take a step back, take just a minute and do some planning and prep. So the first thing would be to assess the need. For example, what I mean by that is make sure you're recruiting apples to apples. So if you have your highest producing provider that is leaving, you're not going to be able to go advertise and bring in a newly graduated candidate, right? Somebody that's just out of school. Are they going to be able to fill that need? No, they're not going to be able to meet the quota that you have, and they're not going to stay because you're putting too much on them, right? So again, thinking about just take a minute, just stop and take a minute and say, well, do I really need an NP and an FP, or do I need 2 PAs? What do I need really to fill this position? The second step there is gaining support. So make sure you have some buy-in from your fellow staff. I always tell a story about we were hiring a pediatrician. We were wanting to hire a part-time pediatrician because our pediatrician was overbooked. They didn't feel they were overbooked. And so if we wouldn't have gotten her buy-in, how would that have been successful, right? Would that pediatrician have stayed working with somebody that didn't want him there in the first place? So we made her a part of the hiring process, and she had say-so in who was hired and what it would look like. And so again, we got buy-in. So that's a big, big thing on step 2. Step 3 and 4, I'm going to go into in more detail, but building your recruitment team and defining your opportunity are pretty big ones. Step 5, after you've done step 3 and 4, what is your ideal candidate? What are you looking for there? Do you need somebody with leadership skills? Do you need somebody that's organized? Do you need somebody that an FP with OB? Good luck on that. Do you need, what do you need? What is your ideal candidate? And then the last step we talk about in planning and prep is creating a budget. And this gets overlooked a lot. A lot of times people don't even think about a budget at all in their recruitment. I mean, they may have like, oh, we have a search firm, so we have money put in for that. But when you think about a budget, what does that really entail? Do you include your people's time? Do you include marketing materials? Do you include advertisement? Do you include legal fees? Do you include the loss of the provider, the loss of revenue? All of these things should be included into your budget. Now I'm going to go a little bit deeper dive into step 3, forming a recruitment team. And the reason I'm going into this one a little bit more is because I feel like this is one of those strategies that you can really use. A lot of time when people think about recruitment, they just think it's just the recruiter and HR, right? But we encourage you to take a step back and look at who really is part of your recruitment team. Think everything through. Even if you're a small little location and you may have one person wearing many hats, it still needs to be thought through on each step, who's going to be responsible for what. So we also talk about thinking about outside of your facility itself, your community. So your principals of your school, your chamber of your commerce, your board members, bankers, real estate agents. I always even say if you're in a small rural area and your claim to fame is a blinking light, and you have a coffee shop, and there's Ned that's been in the coffee shop every day for the last 50 years, include Ned on your tour, right? He probably knows so much about the history of the town. So think again outside the box, who else is on your recruitment team? And then another key thing to do too is when you think about your recruitment team, so that's externally, right? Your community, who's on your community? Internally, who do you have? What team is going to be interviewing? Think about your on-site visit team, who's going to be there. If there's family members or spouse or partners that are coming into, who's going to be a part of that recruitment team to talk to them. So it's not just one person in this role, okay, on the recruitment. It's a lot bigger than that. And so in our manual, we have an actual fillable PDF that goes through each one of these steps that helps you think through, okay, who is the person on this, right? So determine and provider supply and demand, for example, which be your CFO and medical director. Like think through a little bit about who's on my team, who's responsible for what, and just take that extra moment or two to assign roles to really get an understanding of who's responsible for what on your recruitment team. Okay, this next step, this is a really important step. And the reason is what you discover here, you're going to use in your sourcing documents, you're going to use in your interviews, you're going to use on your on-site visits, you're going to use in retention efforts. So this is a really big step. And what we're doing here is doing something that I call unique selling points. I want you to come up with what your unique selling points are. And when you do this, you're going to look at your facilities and figure out your strengths and, well, not even your facilities. You're going to look at 3 different parts. You're going to look at your strengths and your challenges. And then it'll also help you define your ideal candidate, which is in step 5. And it's also going to let your candidates understand if they're the right fit for you. So what do I mean by this? I want you to look at your setting, your community, and your compensation when you're defining your opportunity. So I want you to have this question in mind when you go through these 3 different sections. Why do you work there? Okay. What was it about the job that made you apply for it? Right? Like why were you interested in working for the place that you're at right now? What was it about it that made you interested? Okay. What was it? So think about that as you go through these. So the first thing we're going to look at is looking at your practice setting. And I have a couple of things in here too on COVID. So under our new normal world, like what was your COVID-19 response? What is your PPE? How are you going to keep your employees safe? This is something that can be either a very good, unique selling point at this point in time. So look at that. What are the responsibilities that the person's going to be having? What is your setting like? What's your patient population like? What's your staffing like? Sometimes I think people overlook their own staffing, and I'm going to say it a number of times, but your staff can be a really great source for candidates. And when I mean that, I mean you can put a number of things in like your job posting, like for example, the average years of service of our RN staff is 37, or collectively we have over 1,000 years of experience, you know, if you've got 100 people that are RNs or whatever. So think about things in that kind of perspective. Your facilities. I'm going to talk about facilities a little bit. So if you have an older building, but you have plans to do something new, any renovation, and even if it's a 5-year plan, right? Like it's not something that's going to have it happen immediately. Make sure you're still sharing that with all of your potential new hires so that they know what your hopes and dreams are. Always share your hopes and dreams so that they know, one, how they can be involved in your future and what that future is going to look like. Don't always let, sometimes we have, I'll give you an example. I was with the health center in New York, the state of New York, and they were housed in the bottom basement of the county health department. They had no windows, but they had purchased a huge, huge building and were in the middle of renovating it. And they kept saying, we keep interviewing providers, but nobody will stay. And I was like, well, what are you doing? And they're like, well, we take them to lunch and then we give them a tour. And I'm like, do you take them to the new building? Do you talk about the new building? And they were like, no. And I go, well, that's probably part of the problem is nobody wants to work in a basement without windows for the next 20 years. So think that through. Like, even if you have plans or dreams, make sure you're sharing those. So ask yourself this question. Does your community do some things better than others? And I'm sure everybody's got at least one thing that their community does think better than others. So with that in mind, I want you to define your community. Now, your community is where you can usually find the most unique assets or unique selling points. So if you have great hunting and fishing. One thing about your community, though, I want to talk, it's where you can find your most unique selling points, but it's also something that you got to think through because, for example, hunting and fishing. Where I'm from, we have great hunting and fishing. And so when I would advertise and do my interview questions, I wanted somebody that enjoyed hunting or fishing, correct? However, every employer in my town can say that. It's not unique to me, right? It's not unique. It's not something that I can claim, but yet my other health systems in the area couldn't claim, right? So what we did was we paid for hunting and fishing license. It was like $15 a year for employees. So we paid for hunting and fishing license. And then of course, because we cared about work-life balance, we also let them off opening day of whatever they were interested in, whether it's fly fishing, deer hunting, whatever it may be. Now, of course, we couldn't do every employee off every year. We did a rotation to keep it fair. But again, that was something that I could advertise and we could bring up in our interview questions, and we talk about retention as well. That was unique to us. We took something that was about our community that was great, but made it a unique selling point about us. So that's what I challenge you to look at here. So what is your shopping? What's your education? What are your schools like? What is your culture like? What is recreation? I'll give you another example of shopping. There's a health center in, I think it actually was a hospital, a community access hospital in Montana. And they were having an issue because they have no shopping. They're in the middle of Montana. So they ended up paying for Amazon Prime for all of their employees. So whatever they wanted, they could get within 2 days. And that helped with the issue. They had a challenge of shopping, and they took that and turned it into a strength and a unique selling point. So I'm just trying to get you to think things along those lines. And then the last piece we're going to talk about is your compensation. I know compensation is tough, right? Everybody feels like they're competing and they can only pay so much, and that's true. But think about it. I want you to do something which is what I call the total compensation worksheet. So think about if you could, this is a retention tool and a recruitment tool. And I'll tell you another tip for this too, but on the total compensation worksheet, I want you to list out everything, every benefit that you offer. If you give discount tickets to something, if you, all your paid time off, if you have AT&T, you get a discount through AT&T for their cell phone. I want all of that included in your total compensation worksheet. And you can create one for each position based on an average salary and average benefits, and you can present that to a person. The reason these are so valuable are that they show the candidate and the employee what you're invested in with them. like how much you care about them that you spend this much on them. Okay, and that how much you're investing in them. Another thing to do, and this is part of your recruitment team, we had a financial person that handled our 403B, and he would meet with every employee annually, but he also met with my potential new hires, and he would say, what is your goal in 5 to 10 years? What's your financial goal? And he had like a range. He knew a range of a salary that we would present, and he knew our benefits. So he knew kind of what this person could be making, never exact numbers, but kind of what they could be making. And he would say, this is how this health center can help you achieve that. Okay. So again, there's someone else on your recruitment team that you can bring in. And another way that you can define your benefits, your compensation in a way that would be unique for you and a good selling point. Okay. So that kind of finishes up our planning and prep, and I want you to think about this going into the next area. Do different candidates want different things in a job? Yes, right? So do you think it's possible to strategically target candidates based on your strengths? Yes, no, sounds complicated. You just want somebody breathing it in there, right? So I'm going to say the answer is yes. If you look at your strengths, it's able to strategically target candidates based on that. And that's what we're going to do right now. We're going to talk about part 2, sourcing for candidates. This is all one step. So this whole part 2 is all about sourcing for candidates. In this, you're going to like write effective job postings. We're going to talk a little bit about social media, types of sourcing, those type of things. First thing I want to talk about is creating an effective job ad. When you are writing your job posting, I want you to remember one thing. People buy products for their own reasons, not yours. And you are selling a product. You're selling your position, right? The only thing you need in there is what matters to the candidate. Okay? So what you don't need, and remember, I'm an HR person, so I can say these things, but you don't need the obvious. You don't need to tell a medical doctor that he needs to be graduate from accredited medical school, right? You don't need HR lingo like the incumbent. You don't need every little detail. They have to lift 20 pounds, okay? And you don't need excruciating detail about your organization or your location, okay? So this is what you do need. You need to answer these questions. Remember when I was telling you one of the core beliefs is communication must be candidate driven, right? So belonging, am I the kind of person, think about yourself, right? Wouldn't you want these answered, right, in your current role? Belonging, am I the kind of person you're looking for? Fulfillment, will I be content? Esteem, will I be respected? And prosperity, will I thrive? Another thing I want you to keep in the back of your mind too is spouse, partner, family. On anybody that you're recruiting, especially that's mostly for somebody coming from outside your area, moving in to work for you. Will they be at home in your community? Will they be content? Will they be respected? Will they thrive? Okay. So what does that look like, right? What's your competitive advantage? How do you answer belonging? Well, you answer belonging through your story, your providers and stories, your employee stories. Again, your employees are such a great resource for sourcing. And teamwork. So for an example, in a job posting, it may look like we're looking for a motivated, mission-driven nurse who's looking to be part of our growth as well as their own. Okay. Fulfillment, quality of care, clinical autonomy, making a difference. In our world, in our safety net facility world, making a difference is huge. So here's what that would look like. We see patients from pre-birth and up. We pride ourselves on our ability to provide health care for all aspects of our patients' health and well-being, okay? Esteem, and for those we're talking like clinical leadership, opportunities to teach or advancement. Another big one is, are you considered an employer of choice in your area? And so here's another one. Our team is just that, a team. We thrive around our culture and respecting a team-based approach to care, okay? And then, sorry about that. And then prosperity, loan repayment, competitive pay, remember your compensation. Our culture emphasizes our team members' health and well-being as much as our patients. Okay, again, it's just putting a little bit of a spin. It's not necessarily all about money. It's all about their well-being. That's prosperity as a whole. So these are just some ideas I want you to think about when you're doing your job ad. And some more little tips on doing your job ad, links to your website and others, simple videos, photos, maps, attractions, testimonials. Video testimonials from your employees are one of the best things you can do. Last piece I'm going to talk about is mobile friendly. So I'm going to show you this next slide. If this is what your current job posting looks like, you need to make a drastic change. I'm going to challenge you to right now get your phone out and look up one of your job postings on your phone. If you are using, and this is my number one thing, I've said it a million times, Cassidy's probably sick of hearing me say it, but do not use a job description from HR for your job posting. Okay, you need to sell this position. I challenge you to get out your phone right now, look at your job posting and think about it. Would you apply for that job? Would you go through right now? How difficult is it to apply for the job on your phone? Our phones have made us very lazy readers. We want information, we want it quick, we want to be able to digest everything we need to know within 2 or 3 minutes. So your videos should be no more than 60 to 90 seconds if you include video links. And again, it should be something that could be very easily scrolled and very easy to apply for. Okay, this is not it. A job description is not a good job ad. It's not going to be effective. So this is what might work a little bit better. And this is actually ideal for like your job boards, right? Or your own website. I didn't have time to go today. I will show you here in a little bit about social media, what one of those would look like. But if you read through this right here, this is not a job description. It's a job posting, okay? There's 2, 3 links in there to videos. There's a testimonial for why nurse practitioners choose to work at XYZ. There's a little bit about state loan repayment. There's a little bit about Philadelphia, right? So this posting right here covers all 4 of our questions. And again, I'm going to say it again. Please do not use a job description as your job posting. At 3RNet, part of what we do is we run a nonprofit job board for safety net facilities to post their positions. And I can't tell you out of the thousands of jobs that we have posted, how many of them are just job descriptions. Especially if you're looking for a provider. Your provider 9 times out of 10 is looking at your job posting in between patients or quickly when they have a minute or 2 on their phone. So you need to make it as easy for them to get you their contact information as possible. Okay, so the next piece that we're going to go over, social media, everybody's favorite. We use Facebook, Twitter, and LinkedIn, and what we share are generally blog posts, job postings, events. We also do a lot with our partners like National Health Service Corps. And then the key to this too is reuse, recycle, revamp, expand. Don't feel like you have to reinvent the wheel every single time you post. A lot of what we see working for employers is something on your Facebook or your social media about your services, like little tips on how to be healthy, jobs, of course, things about your staff, reviews, fundraising, and then any kind of trends or topical information. So social media can be overwhelming to people. And so we're going to talk a little bit about Bitly and Buffer. Bitly.com is that it's a free site that you have your web link that you want to put in your Twitter or Facebook or even on the job board, where it links back to your website to show your job posting and for them to apply. You put your URL into Bitly and it makes it really short. It condenses it down to like 8 or 9 characters, so that you're not using up a lot of your character space in social media. It's completely free, and I'm sure you see them a lot. You'll see the bit.ly links and anything that you're trying to click on. The other thing I'm going to talk about is buffer.com, which is it's a scheduling app for your social media, and it makes your life so much easier. We use a master spreadsheet to organize content and make it easy to reuse and revamp every year. So this is what Buffer looks like. What Buffer does is, and there's another one called Hootsuite that's free. Both of these are free. And so if you've ever been in charge of doing the social media post, this will make your life so much easier. We have a director of marketing and communication that does all of ours, but twice she has gone on maternity leave for 8 weeks, and it has fallen to me. And if it was not for Buffer, I don't think I would have survived. So the cool thing about this is, if you can see here on the left-hand side, you have Facebook, Twitter, and LinkedIn. Already our accounts are already linked in. We write one post, which you can see this is one post right here, and we use bit.ly, right? We take that one post, and then this is the cool thing, okay? You can schedule it at any time you want. So if you want that one post to show up 3 times in the next month, you can have it do that. Or if you want to set it out for 3 weeks at a time. So what I did was I took a Monday morning, she had a spreadsheet of what all we were going to post for, and I just went through and put all of our posts in, and I scheduled it out for the full 8 weeks, and I was done. So if you just want to create 15, 20 of your posts at one time, then you can schedule them out for, and then you have 8 weeks worth of posts all done at one time. It's not something you have to do every single day. Social media ads. This is another thing that we talk about. A lot of people don't necessarily use their ads on Facebook like they should. You can boost your ads very cheaply. I think we spend over maybe $250 a year boosting our ads. And what you would do, like, let's say you're looking for a provider. You have your bit.ly link, you have your scheduled, it's scheduled in Buffer, it's going to come out, and you want to boost it. You boost it, and what you do is you add groups, and you say friends of, and it could be AAFP, right? The American Association of Family Physicians. Anybody that likes their page will now see your job posting. Okay, if you're looking for nursing, any of your nursing associations, local, state, national. You're looking for MAs, any of your local, state, national associations. Like, think of those kind of people, not just those that like just your Facebook page, but go out to these national organizations or these state organizations that professionals are already like their page and a part of. One of the things too is we like so much is, and I just pointed this out, few hundred to few thousand people on a shoestring budget. Here are some more free and low cost resources that we use. We use Fiverr. It is a marketing and digital product service website, which you got it, everything's $5. We have used this to create one of those whiteboard videos. You know, it's the video where there's a voiceover and you can see the person drawing the characters. We have about a 90-second whiteboard video on how easy it is to register with 3RNet for free on our webpage, and we got that for $35. Weebly is another thing that we use. We use that for our academy. It's a website builder. So if you're using your website as a recruitment tool, which you should be, but you have issues because it's probably viewed as a patient website, not necessarily as a recruitment tool, and you want to build your own, this is so easy, Weebly. You literally just drag and click. I've already talked about bit.ly and Buffer, and then Canva is another thing. If you're a nonprofit, you can get for free. It has thousands and thousands and thousands of graphics for free. Next thing we're going to talk about is where you source. So what we see working today with our members and all of the health centers and hospitals that we work with, we see, of course, job boards. And the new normal virtual job fairs are really becoming a big thing right now, networking, and then, of course, specialty advertising. Some of the job boards that we go through or use are Practice Link, Practice Match, Healthy Careers, Career MD, MD job site, and then the National Health Service Corps. I wanted to touch on the new normal, the virtual job fairs, just a little bit. I'm not sure if you're using them or not, but one of the things that are just some kind of tips or tricks that we have found some of our members are using is maybe participate in a dress rehearsal if the vendor has the opportunity. That's where you as an employer can have a chance to go in and kind of do a dress rehearsal on the job fair if you're not familiar with it or haven't done it before, so you can kind of understand what to do. If you're visiting residency programs virtually, one of our members still provides food. They have a food truck show up at the site at the same time the job fair is going in. Another thing too, if you're using a different platform, we found it beneficial to have Zoom as a backup if the platform goes down. And then also you could also use the Zoom to coordinate if you have a bunch of your different staff, maybe in different locations that are going to be on the job here as kind of a second, as a like kind of a back room, right? Like a break room that you guys can go in. And then the last thing is make sure you have information readily available that you can cut and paste about your job and opportunity to drop into chats when people are asking specific questions. Of course, networking is going to be another huge thing. Residency. Referrals from, we say providers, but really referrals from your employees. I can't stress this enough, how much you can use testimonial from your current employees. If you have an employee referral program or if you don't have one, I highly recommend that you implement one. It's just, your employees are really one of the best recruitment tools that you can have. What isn't working, what we're seeing, although print advertisements, I've seen that come back a little bit. I'm not talking about a newspaper ad in a rural or small area. That is still very effective. But there for a while, most generally, if you were still mailing postcards or mailing pieces, there was only about a 2% open rate on those, or a 2% call to action rate on those. So those were not very effective. In the world of email, though, it seems like those are trending back up just a little bit, but still something that I would think twice about the cost versus the outcome. Again, posting without being strategic and not having any input from your employees. One of the things I'll say too about having input from your employees, if you can talk to them and find out what keywords or phrases hold meaning for them, you can use those in your Twitter ads, Facebook ads by hashtagging them and help draw in people that with the like mind. Again, that'll be a strength that you can do. All right, that kind of concludes part 2. That was another step 7, another big important step. Part 3, we're going to talk about screening your candidates. During this, we have these 5 steps, and you can see the bold ones are the ones I'm going to talk more about. On step 9, of course, conducting your credential checks and checking references. That's a given in today's world. Okay, so when we talk about interviewing and the new normal that we have right now, you're most likely conducting everything virtually. This is probably about your 8th or 10th Zoom call already this week, right? So before, we just want to talk a little bit about virtual interviews and what that means in today's world. So make sure you're establishing your preferred virtual meeting format, whether it's Zoom or Teams or whatever it is that you're using, WebEx. Make sure that you are familiar with it. So before you do that, you can prepare your staff, but also the candidate. So whenever you go to set up an interview with the candidate, I think it's a really helpful thing to do, just to include in your communication about how they log in and when they log in, but also just some expectations like minimal noise. This is how you actually get into it. This is how you mute your phone. This is how you show video. Just a little tips and tricks maybe for every candidate. You got to remember that there are generational differences in the virtual interviewing, and so what one person may be comfortable with, another person may not. So I always think it's really nice to set those expectations and include a tip guide. Also to your people, that your staff itself as well. Make sure you're testing your tech, that there's minimum distractions, okay? Preparation is the key. Before your interview, again, is everyone on board? Does everyone know who you're interviewing, why you're interviewing, what their qualifications are, what their interests are? Make sure your team is prepped. One thing too I would like to talk about right now is the type of communication for the recruitment process. Remember that, again, when I just talked about generational differences, different generations want to be communicated with in different ways. So some generations want a text. So you may send them a text saying, reminder, you have a phone interview tomorrow, or reminder, you have a face-to-face interview, that kind of thing. Someone else may want an email. Someone else may want a phone call. So make sure that you remember the communication preference whenever you are working through your process. Another good thing to do too is make sure you have like the contract in your mind going, what your compensation is going to be, all of that. There are multiple approaches for interviewing. Of course, there's behavior-based, which is high value, data gathering, fact finding. That's basically finding out if they meet your minimum requirements. And then open-ended questions is the opportunity for the candidate to share, maybe in a less directed fashion. I'm going to make a case for behavior-based interviewing. It's basically past behavior is going to be your best predictor of your future behavior. So what they've done before, you can kind of have an idea what they'll do in a future situation. It's really becoming more and more prevalent. It does minimize subjectivity and that halo effect. And it makes you really understand if someone's a fit for your organization. So when we're doing that for behavior-based, it's not just an open-ended question and there are no magic questions, but great starters are like, tell me about a time, or describe for me, or give me an example of. The biggest thing I want you to remember about behavior-based interviewing is that you need to ask for a specific example of a situation, learn what action was taken, and then this is another key, get the result. What happened? A lot of times you'll ask somebody like, tell me about a difficult patient that you had to deal with. And they're like, oh, we have difficult patients all the time. And we just always, I would stop them right there. We don't want to know about difficult. We want to know a specific example of what happened. And then we want to know exactly what action, what that person individually, not we as a group or not what we're trained to do, what that person as an individual did and what was the result. That's one thing I always say too about interviewing is don't be afraid to stop the person and say, redirect them with the question, the information that you're actually wanting. Another important step that we think, especially here at 3RNet, is we talk about interviewing the spouse and partner. And what we mean by that is we're not talking like an HR interview, like saying ask the partner where they're going to be in 5 years. We just mean whenever you, this is more relevant to whenever, if you're going to have an on-site interview, but also is you can just say, hey, is there anybody we should talk to about this position? Is there anybody else that's going to help you make this decision that may have questions? And then you just get to know them. Or are they going to be, and when we come on the on-site interview, is there anybody else that's going to be coming with you? And what would they be interested in? Or, you know, oh yeah, my wife wants to come and she wants to know about schools and dance studios in the area. You know, that type of thing. And then you would assign somebody that would know that information really well to be kind of the spouse partner interviewer. On that note, we're going to talk a little bit about site visits. I know right now that may not be looking the same way, and we'll talk about that here in a minute, but basically you know the goal of the site visit. So at this point, you've done all your planning and prep, you've sourced, you've interviewed, and now you think, I really want to see if this is a good fit. I really want to meet this person and see if they can't come with us. And find out if they're a good fit for us, we're a good fit for them, our community is a good fit for them, and so we want to do something more. And usually this is, well, we'll get into that. So the new normal, of course, is that face-to-face interviews and on-site may look very different. So things to keep in mind, communicate your safety precautions and expectations to make the candidates feel comfortable, and the current employees as well. Consider virtual tours of facilities and schools. Set up Zoom meetings with recruitment teams and community recruiters. Remember, your bankers, your real estates, your superintendents. And if the interview or site visit is going to be all virtually, you understand that it may take more than one meeting. Here are some on-site visits that we've seen our members have shared with us that they've been doing. So like if your facility is closed on the weekend, or you have a part of your facility that's closed on the weekend, you can maybe give a tour at that time to help with social distancing and the protocols in place. You can give a community tour by having the candidate follow in a vehicle behind you and use your speakerphone. Another thing you could do is if you have a facility that they'll be coming to and you have a good picture of it, you could use that as your Zoom background and the whole time you're doing the Zoom interview. So when you're thinking about these on-site or whatever type of visits that you end up with, think about the two types, right? There's professional motives and personal motives. So the professional is all income, colleagues, commute, workload, call. Personal motives are location, lifestyle, call, commute, recreation. Is it urban, rural, family, friends, culture, religion, community, okay? So think about those two type of motives that you need to showcase. And again, back to your unique selling points. Were there things in your community or facility or your staff that you wanted to share, right? That you wanted to come out in this particular visit, that you wanted to showcase. We state that a 2 full-day site visit, if you're bringing a provider in from out of state, is probably ideal. It gives them the most time to really get an understanding of you and you get an understanding of them. One thing I will tell you, if you do something like that, if you have somebody coming in from out of state or out of the area and they're staying the night and you're wanting to do that, make sure that you give them downtime. Don't schedule them from 8 to noon and then schedule them for lunch to be speaking to a bunch of people, and then from lunch to dinner, and they get to go back to the hotel for 45 minutes, then they meet again for dinner that night. They need a little bit of time to decompress. They need a little bit of time to think about, absorb what they've seen. They need a little time to explore on their own. And there's nothing worse. I always say the working lunch is awful because there's nothing worse. People want to ask someone a question and they're trying to eat at the same time they're starved, especially if they came in from a different time zone, right? So make sure that you're not over scheduling. All right, the last part I'm going to talk about is follow up and follow through. So right after the site visit, make sure you do an immediate follow-up. Remember that communication preference, whether that's a text or an email. Share stuff from either their interview or visit. If they brought up something in their interview, like they were really interested in little fairs, and you can let them send a link about the local apple festival that's going to be happening in the next month or so. Just make it as personalized as you can. Negotiations. I want to talk about this real quick. Remember back in step 3, I said make sure you have a recruitment team. Your negotiator is part of that recruitment team. This needs to be somebody who has the authority to do what needs to be done. If there's still questions about what their schedule is going to be like, what their pay is going to be like, you need to make sure that the person that is reaching out with them at this point has that authority. And the one thing I want to say is the negotiator needs to find out if there's a barrier, if something can be done about that barrier so that the answer is yes and not no. And if the answer ends up just being no, they're not going to take the position. Make sure you find out why and see if in the future there's anything that you can glean from it. If there's any opportunities you can turn into a strength. Okay, the last step we're going to talk about is step 15, which is, of course, a retention plan. I just have a few things I want to go through over this. So if you're using the recruitment for a retention approach, then you've already done a great job of retention building, because remember we said it started all the way back. So you've already started trying to recruit to your strengths, right? Which is a good foundation. Onboarding is a key in retention because it builds a foundation of the relationship, and then you need to have ongoing retention efforts for the life cycle of your employee. This fourth point I want to talk about just for a minute. Dr. Don Pathman of the North Carolina Foundation did a 20-year study with providers in particular and found that the reason that they will leave is leadership and spousal satisfaction. Those are the top 2 reasons that they ever leave their current position. So when you're looking at retention, those are 2 areas you might want to look at. Just like we had recruitment kind of core principles, these are some retention principles that Dr. Pathman found out of that 20-year study. Retention success is possible in any geographic location. And what he means by that is kind of lends into the retention factors do not equal recruitment factors. So your geography may be a barrier to the recruitment, but if you can get them and get them hired, they are not going to leave because of it. Okay, unless maybe you're Alaska, and then it's because they haven't experienced the 8 months of darkness. But generally speaking, your geography is not going to be a reason for them to leave. Retention, of course, is a good fit and good relationship, right, between you and the communities. And then this last key is what he found, which we've already said. No one stays in a bad job, right? No one does. Not you, not them, nobody. So good administration and good relationships are key. And a lot of what these retention strategies I'm going to tell you about talk a lot about trust and relationships. So real quick, I just want to address the new normal. I know that because of COVID, a lot of your workforce got blown up. A lot of the way you did things got blown up. So right now we kind of have people in maybe these 3 categories that weren't necessarily in them before. So essential workers, you know, they're employees on the front line. How did you compensate? Did you think beyond? How did you support them? You know, there are a lot of people that went without seeing their family because they didn't want to infect them or hurt them. How did you support them during that time? There's still childcare issues. And then on the work from home, is that something you'll continue? What did you support? You know, are you being, we have a lot of people that are still schooling from home, virtual learning. Are you kind, or are you okay with schedules being flexible, with the kids walking in on the meetings, the dogs barking in the background? You know, are you able to give some slack? And then the other thing too about essential and work from home and your employees as a whole and yourself, make sure that you're looking at self-care, that you're utilizing the EAPs, that mental health is a priority as we go through all of this. Okay, so it's one of the #1 things I can say right now. And I do talk about that here in just a minute. And then finally, you know, your laid off or furloughed employees, it forever changes your work landscape, right? So if you're having to lay off employees or furloughs, there are strategies that you can do. Make sure you're looking at workforces and processes or anything you can do before you actually have to lay them off. Here's just a list of some of the things that you can do, because sometimes it feels very much like you're out of control. You don't know what you can do. So keep mental health a priority. Communicate. So there's no such thing as over communicating. Be honest. You don't have to have all the answers. Be as flexible as possible. Adjust your PTO policies. Create or update your business continuity plan and your contagious disease policies. Make sure you're scheduling routine check-ins, especially with those stay-at-home people, because they have that sense of isolation, out of mind, out of sight. Go above and beyond, and then focus on what you can control. Okay, lastly, these are just normal life cycle retention strategies. These are things that you should be doing with or without COVID. Like the first thing right on there is onboarding. Onboarding is not a new fancy word for orientation. Generally, onboarding lasts anywhere from 3 to 12 months. Orientation is a huge part of that. It's kind of a stepping stone onto onboarding, but onboarding will include that the employee is fully acclimated. They completely understand what to do on their day-to-day. They understand your culture, and they participate willingly in your activities. That's what successful onboarding looks like. Engagement satisfaction surveys. Make sure you are conducting these at least annually, biannually, quarterly. The biggest thing about satisfaction surveys or engagement surveys are there's no point in asking your employees their opinions if you're not going to do any follow-up. Okay, there should always be an action plan. You should share those results. You need to let them know that, one, you heard them. 2, this is what you're doing to address their concerns. Or 3, we heard you, but we are not going to do anything, and this is why. So either yes, you're going to do something, or no, you're not, and this is why. But the most important thing is that you heard them and that you're willing to invest in what you can invest in. Okay, if you're not going to take those extra steps, then it really is not a very good strategy. The third one here is one of my favorites. It's the stay interviews. So this is an informal process between a manager and their employee. And it's basically exactly that. The manager's taking time to talk to the employee and just say, why would you leave? What would cause you to leave? And this builds a level of trust between the manager and the employee that is essential for retention. That level of trust does a couple of things. One, it places the responsibility for staying on the employee, okay? And 2, again, it lets the employee know how much you're valued. In our culture nowadays, we have a tendency of not wanting to tell somebody that we want them to stay. We're always trying to CYA, right? And make sure we don't say the wrong thing or do the wrong thing. But if you have an employee that you want to stay, or you can figure out, a lot of times stuff was discovered in exit interviews. This is a way to be proactive and to build that trust. The next thing we're looking at is succession planning, making sure you have career ladders in place and those key roles are identified with somebody to step in. Staffing needs. This is one, make sure your people aren't overburdened and you're leading into burnout. Work-life balance, I've talked about that earlier. I'm not a real fan of that work-life balance. Makes me feel like they're kind of warring with each other, but really what it is work is an important part of your life, and make sure that you have a culture that honors that. Compensation surveys, make sure you're paying people what they should be paid, and then again, looking for those unique benefits. I've included a retention calculator here that HRSA put out that kind of gives you a really neat glance at all of your employees, and you can figure out how long you've been retaining them. All right, here's my takeaways from this whole thing. Real quick, recruitment is a process. Identify and communicate your strengths, invest in challenges, don't skip planning. Communication should be candidate driven. Look for barriers to viewing and applying for your positions. Create a lasting first impression. Tackle social media. Work smarter, not harder. Share your value through your teamwork. Utilize all your screening tools to make sure you have the right fit. Interviewing looks very different now, so don't shy away from the social or virtual interviews. Use your unique selling points throughout the whole process. Don't forget your community. Retention starts in recruitment. Rethink your processes and policies. Build trust. Relationships lead to lasting employee engagement. And retention may not be the objective. Every hire won't be a fit. And that's the end of my presentation. I think Cassidy wanted some time for questions. Sorry if I'm butting up on the hour there.
That's okay, Michelle. It was a lot of great information. Thank you. We do have a couple of things in chat, so I want to get to those quickly. Let's see. Early in the presentation, someone commented in regards to listing out your total compensation. Budget can also include funds for matching state loan repayment program awards if available. We had a couple of people interested in the recruitment manual that you mentioned, but I think that might be part of your academy. Is that correct?
Say that again, Cassidy.
A couple of people mentioned the recruitment manual, and I don't know if that was something in the intro or that you had mentioned. Is that part of your academy?
It is part of the academy. If you go to the academy website, they can get it, or depending on what state they're in, they can go to 3rnet.org members and just reach out to their member, and they can email it to them.
Perfect.
But if they sign up for the academy, they'll get it that way as well.
Excellent. Someone also asked if Fiverr created your whiteboard tool for you.
They did.
Excellent. And yes, you will be able to get a copy of the slides. We had a couple of people ask for that. And then, excuse me, we had a question about turnover benchmarking. This hospital is a 25-bed critical access hospital, and they have a turnover rate of 11.8%, and they're just curious if you know where they stand in terms of the benchmarks for turnover.
If you go to that calculator out to HRSA's website, they will give you that benchmark data, and you can do it, I believe, national, state, and region.
Great. Thank you, Michelle. So those are all of the questions that we had in the chat, and I know we have just pushed over the top of the hour. So if there are any other questions, please go ahead and quickly get them into chat. You can also probably unmute yourself and ask your question if you would like. But I will just do a couple of announcements while we give everyone a last chance to get a question in. As I said, we will be sharing the slides. You will get an email following this webinar that has a link to the recording, so you can listen again or share it with your team members. If you have any follow-up questions, please feel free to reach out to us. We work closely with the team at 3RNet to get your questions answered and support you any way we can. So just let us know if you have follow-up questions. And we thank you for being with us today. I don't see anything else coming in. So since we're a couple minutes over, I will go ahead and adjourn this webinar. Thank you, everyone. Thank you, Michelle, so much for presenting today. It was an excellent presentation.
Thank you, Cassidy.
Bye, everyone.